Hi again, welcome back to another video about the CMC joint replacement that I've had recently, and we're just following on my little operation journey, post-operative stuff as well. So if you haven't watched some of my other videos about this, then they're on my channel, so you can go and have a quick look at those. So today so it's been 3 weeks since surgery day today. I had my stitches out 5 days ago, and I had the plaster cast removed. I had like a back slab and it was all bandaged up and everything with the thumb immobilized. So that all came off 5 days ago at the end of last week. Super happy with the progress of it. So I have not had any pain since probably like a couple of days post-op was probably the last time I took Panadol or anything. And I've said in my previous video that it was probably those first 48 hours that I probably had additional pain relief, but after that, another day or another evening, I think I did take some Panadol in the evening. But apart from that, I've taken nothing ever since. So, and it hasn't been painful. So to me, this is already better than what my thumb felt like prior to having the surgery. So I'm already winning as far as I'm concerned. But yeah, once we got it off and had a look at it, very, very happy with the progress of the healing and the ability to move my hand and my thumb already. So the surgeon was ecstatic. He was just like, wow, this is amazing. This is really, really good. He went and brought in some of the other trainee orthopedics surgeons and brought them in to have a look at it. And compared to the previous type of surgery that they would do for this, which was like a what do they call it? I can't remember the name, but what it's specifically called. But basically, they would take out the trapezium bone and then perform a tenotomy. So that's where they take a piece of tendon from further up in your forearm, and then they graft that onto your other wrist bones and your base of thumb, and then that is what provides the ability to move that thumb into the future. So that's quite a few months worth of rehabilitation to get function back, to train that tendon to do that job. So it's quite a lengthy process, but that was up until the joint replacement option. That was the go-to for having base of thumb arthroplasty. That's the word. So compared to that, it's just a vastly different surgical procedure, obviously, but it's also just a vastly different outcome in terms of recovery and the ability to get back to normal functioning again. So for me, I'm mid-50s and still got lots of working life ahead of me. I am a nurse, so it's really important for me that I have the ability to give people injections and do wound care, hold forceps and things like that. So for me, getting back to work ASAP was a top priority. Getting function and strength back was also another priority. So that was the reason why I chose to go with this rather than the other one. And I think it's turned out to be the absolute right decision. So let's have a look at the wound. So this is, as I said, I had these out 5 days ago, and I've been rubbing some moisturizer and doing some massage around the scar, which I'll do that in a second, just to sort of soften it up because it gets a bit dry and scaly with the scabbiness there. But so I've been putting some oil on it, like bio oil type stuff, and moisturizing and massaging. So the scar itself is healing quite well. I don't know if you can kind of see that there. There's a bit of light there. There's still a bit of swelling there, so we're comparing the two. But there's the function that I can do so far. Okay, so there's a bit of swelling when you compare the other side, but not too bad, to be honest. So this hand, obviously you can kind of do your fingertip and slide it down kind of thing. This one, it's tight. It doesn't hurt, but it's just really tight. And then I can kind of get it to about there before I can't go any further. So that's something to be kind of working on as part of the hand therapy. So he said And I saw the OT afterwards as well. He said that I can do any of my normal sort of range of movement type of things and be doing these things, but no strength, grip, and heavy carrying or anything like that that's going to involve the thumb until a 6-week mark. So that's when I go back in 6 weeks. I do have a little, I forgot to grab the little splint. Oh, get a splint. Okay, so I've got this little splint that they made. They can mold that to your thumb. So I have to wear that at night time, and I can wear it any other time I want if I just want that bit of support. If you're going out somewhere in public amongst a lot of crowds, you've got the potential to get bumped into, get your hand or your thumb or whatever, get caught on things or whatever, or you just want that little bit of extra security, then that's there. So yeah, they made that, and I can keep that on for the next few weeks. So the only thing I find is that it's not lined on the inside or anything, so it does kind of get a bit sweaty after a while, but I do pretty much just wear it at night time, and you're less likely to be hot and sweaty. Yeah, so scar wise, as I said, looking really, really good. There is a little bit of residual numbness sort of along this sort of side of my thumb. Like I can feel it, but it just feels like it's asleep, you know, like that little bit of thumb, yeah, when you got your foot's gone asleep or something, it just feels a bit altered sensation. Along there. It's actually better up here now. Initially there was a bit of less feeling in there, but that's come back now already. So generally speaking, those superficial nerves that serve your skin, obviously when they're cutting into something, they can be cut. And so there is always that bit of residual numbness. I've had knee replacements, and there was always that, you know, it took a few months before the feeling came back on some of the patches on the skin surrounding the incision line. But a couple of years down the track now, it's pretty much all back. So nerves are very slow to heal. So they do come back. They may not always come back 100%, but I reckon mine's like 95, 97, so it's not too bad. So yeah, so when you're massaging, they'll probably go through this with you at your outpatient clinic or something anyway. But when you're massaging some cream in, you can kind of just be going across the scar and sort of trying to get it moving in different directions. So go acrosswise. You can do your circles right over the top, but also around the scar, do your circles. And then you can kind of just press down on it a little bit and just go up and down, up and down, up and down. And that just sort of gets it mobile, and then you can try and just give it a little bit of a pinch. So you're trying to just pull the skin up off the fascia underneath. That's the layer that you have underneath your skin between your muscles and joints. All right. So yeah, that's just a real quick little demo of what to do with your massage. So yeah, doing that, you'll get really good scar healing and maturation of that incision line. So yeah, in terms of function, I'm pretty much back to doing everything pretty much normally, obviously, except for carrying heavy things. So, but yeah, gripping, picking up things. I'm using a knife and fork. I'm using a pen, cleaning my teeth, doing pretty much all your normal day-to-day activities. Just being mindful not to go carrying the heavy shopping bag full of groceries with that hand. Opening jars and things, don't put too much pressure and strength into opening jars and lids and all those kinds of things. I'm not doing that. I'm still using my lovely little OT tools to do that, or giving it to somebody else. But yeah, apart from that, I must say, I'm just like really happy with the outcome of this. This is my final week off work. I go back to work next week. So back to my normal nursing duty. So it'll be interesting to see then if there's still some things that I can't quite do. I'm already anticipating that there are a couple of things. There's some certain types of medications that are really thick to draw up and then to administer through the injection. So I'll probably have to switch back to my left hand, which is what I was doing before the surgery anyway. And probably, you know, things like spiking an IV bag with the line and all that kind of stuff. I probably won't be able to do that yet because there's quite a bit of force that you have to push and twist at the same time. So yeah, but in terms of holding forceps, I plucked my eyebrows the other night, so I was able to hold my own little forceps to pluck some stray hairs out. So that seemed to go okay. I think I'll be right to take stitches out and do wound care and things like that. So yeah, all in all, I think it's gone pretty good. No pain, getting good function and movement back. With time, get that strength back again. So I'm super happy with this surgery and the results that we've had so far. So if you have any questions, feel free to pop them in the comments below. And if you have any requests about other information that you want me to do some content on, by all means, drop it in that comment box as well. Thanks so much, guys. See you on the next one.